Ready? Okay. Welcome, everybody. It's my honor and privilege to introduce Dr. Hal Huggins. Dr. Huggins received his DDS degree in 1962 from University of Nebraska. In 1973, he became involved in the study and research of mercury toxicity and its impact on human health. He earned his MS degree from the University of Colorado in 1989 with special emphasis in toxicology immunology. It's my great honor to introduce Dr. Hal Huggins. Thank you.
I'm supposed to start by reading this, and it says, I do not have any financial interest in a product. And whoever wrote this should have taken a course in English grammar, I think, or with any component companies offering grant monies. However, if anybody here has one of those, I'd entertain that afterwards for a continuing dental and medical education program. Okay. Well, it is indeed a pleasure to be here. I didn't know whether I was going to make it or not. As some of you have heard, I had a little argument with a couple of things called L3 and L5, which end up being fractured, and just got out of 4 weeks of rehabilitation, learning how to walk yesterday. So this is the first day I've worn pants in a long time, you know. And I'm not going to tell you what's underneath the pants. But there are some things that I feel need to be discussed. To start with, the first meeting is on something that is practical. And the second meeting that we will have following this, I knew that somebody needed to hear. I don't know who that's going to be. I don't have to know. But these two programs are why I went through the rehabilitation. Why I got here. So I appreciate your stimulation, which you didn't know you were giving me, in getting here, because I counted the days until yesterday. One thing that I have spoken on several times is detoxification is retoxification. And this is so important because detoxification is easy. So is retoxification. And why I say that is because with detoxification there are many things. This is a small list of what is available. I'll let you in on a little secret. It's rumored that I'm opinionated. And my opinions are based on now 51 years in practice and over 300,000 individual blood chemistries. So I have reason to be opinionated. That doesn't always mean I'm right. But with chlorella, I flat out say no as detoxification because too much of it is contaminated with mercury. It does not pick up mercury from the body, it picks it up from the swamp. So we have found far more problems with chlorella than we have solutions. EDTA, evaluate that, because here I have a problem. I have a friend who's an MD in New Zealand, and he has a long list of people who have diabetes who did not have to have a leg amputated because of the use of EDTA. That's a pretty good track record. However, EDTA also combines with mercury to form a compound that is similar in chemical nature to thimerosal, and that creates a problem. So you have to evaluate whether you want to use it or not. DMSA in low dosages, we started out with a high dose of 100 milligrams, though some people use 500. After a year or two, we found that was too much. And now we find good results with 25 milligrams Monday, Wednesday, Friday. That is adequate to do a good job of pulling out some of your heavy metals, mercury in particular. DMPS, some people use that in particular in children. DMPS is very hard on the kidney. So be sure to evaluate kidney function before considering DMPS. IV vitamin C, yes. And the slower it is given, the better. In fact, I just heard a couple of days ago from someone who is taking 8 hours to give 50 grams of vitamin C. We take about 4 hours to do it and have good results. But some people do it in an hour. If you do it in an hour, my opinion is you might as well have given the patient a glass of water. Slowly, yes. Glutathione, the dose is critical here. Too much of it is overdose, and it very readily releases and very readily re-toxifies patients. We'll talk about that a little more. Alpha lipoic acid, yes, this is good, again, depending on the dose. Do not overdose. Now, in the regeneration, we control this from the dental practice also. That with regeneration, we want to stimulate the parasympathetic division of the autonomic nervous system. But if we happen to stimulate the sympathetic division, then we're going to create degeneration. How do we do this? If you take out the positive current fillings first, which is crowns and amalgams both, you stimulate 4 of the endocrine glands that are essential for degeneration. We're not going to live forever. Our tissues recycle, some every 30 minutes, some every few days. Some of you, red blood cells, 120 days, white cells, some of them 7 days. This is under the control of the sympathetic and the parasympathetic nervous system. So should you take out the positive current fillings first, you stimulate thyroid, anterior pituitary, adrenaline, and testosterone. But if you simply, at least with the first and second quadrant, take out the negatives first, you get to the fourth quadrant, third and fourth doesn't make that much difference. But if you take out the negative charged crowns, which I have never seen a nickel crown that was not negatively charged. If you take those out first, you can stimulate parathyroid, which controls the calcium. Weston Price wrote 4 books. 3 of them, a lot of you have seen. The 4th one, some of you know that Weston Price put a bunch of things in a big steamer trunk, and from his deathbed asked a friend of his to find someone who could be stimulated to follow up his work in root canals and give that to him. 40 years later, that was given to me. I did follow up. And I found that one of the important things is that Price wrote a book that was never published, a book on calcium metabolism, a book 200 and some pages long. I have not found the pictures that go with that book, but I have the book. Calcium, the ionic form of calcium, which is not what you get with cheese and milk and calcium supplements that you pick up in the drugstore, 1,000 milligrams. No, you're not getting the ionic form of calcium there. But when you have it, it is under the control of the parathyroid gland. So it is very important in removing your fillings and crowns to know that you are controlling the major healing factor, which is the ionic form of calcium. After it is used, which means it's given up its electrons, it is a contaminant, it is of no value. What are you going to do? You either have to get rid of it, which is hard to do, or you can recharge it. You can recharge it within 15 seconds of where you are sitting. If you walk outside, because the sun is shining outside, and the ultraviolet light from the sun will recharge your calcium, putting electrons back on it. We are an electron system. We have electron donors, we have electron recipients. All of these things involve the healing that is controlled by the ionic form of calcium. Posterior pituitary, I first learned about from Melvin Page back in 1968. It is still the primary in control of your emotions. There was a friend of mine one time that I had on posterior pituitary, and he called me on a Saturday, and he said, "Meet me at your office right away. I need some of those pills." And I said, "Well, I'm going to see you on Monday. Why don't I give them to you on Monday?" And he says, "No, you don't understand. We have a family reunion tomorrow on Sunday, and I've run out. And if I take one of those pills, it changes the personality of the next 200 people I meet." Between thyroid and posterior pituitary, that's you. That is your personality. Posterior pituitary is under your control as dentist. You control that person's tendencies toward floating suicidal thoughts, towards "I love you" to "I hate you." All of these things, all of the basic 22 emotions, the polar opposite emotions, are under the control of the dentist. And the bad thing is, dentists are not informed of this. Insulin, many of you have probably heard me talk about the 55 non-diabetic uses of insulin. You can manufacture your own. Sometimes you have diseases that need a little more help, like surgery. If you have done surgery, I half kiddingly say, when you're injecting protamine zinc insulin, get the needle out fast or it'll heal in place, because it does stimulate healing very rapidly. Estrogen is the polar opposite to testosterone. Estrogen and testosterone both have problems if they're overdosed or if they're in the wrong place at the wrong time. So stimulate the production of estrogen, especially if you are doing surgery. But if you are just taking out the amalgams and nothing else, you are still upsetting the balance between estrogen and testosterone. No. Detoxification needs to be monitored and can be monitored. This is the important thing about it. And one of your first monitors would be serum calcium. If the serum calcium is around 9.3 milligrams percent, your patient is in good shape. If it gets down into the 8s, which isn't very far from 9.3, if it gets down to 8.8, you do not have the healing capacity. But you can measure it. If you are detoxing too fast, you will have the serum calcium dropping down. You will have the liver function enzymes, SGOT and SGPT, elevating. Who does your detoxification? Liver and kidney. So if liver and kidney are overtaxed, you're performing retoxification. Just because you take some mercury out of the belly fat and put it in the brain does not mean you have improved the health of that patient. So SGOT and SGPT, there are other liver function enzymes. Bilirubin is another one you might want to watch. But as these go up, you are detoxing too fast. Serum albumin is prime. It is number one. It is the best detoxifier in the body, and it is also the primary transportation system in the blood for bringing in vitamins, minerals, hormones, all of the things, amino acids, fatty acids, the things that we need to rebuild the body are transported by albumin. Where does albumin come from? This is something you need to know. Number two in detoxification is cholesterol. And we all know how maligned cholesterol has been. Oh, if it goes up, you lick a stick of butter and you're going to have a heart attack and you're going to die on the spot. This is what we are led to believe. Nothing could be farther from the truth. Cholesterol is primary in reconstruction of the body. Cholesterol is a great detoxifier. It can even detoxify Clostridium perfringens, which, since I started learning about DNA, I've learned that Clostridium is something that we can furnish our patients with root canals. And Clostridium, well, the botulism is considered about number one as far as being bad is concerned, but Clostridium perfringens is not far behind. It can be wiped out by cholesterol. If you're on a low cholesterol diet, then the Clostridium will take over. Sodium and potassium, other things that are being maligned. If you eat salt on your food, again, you're going to have another heart attack and die again. Nothing can be polar opposite to that anymore. Sodium and potassium are critical to neurological patients. They're critical to getting things in and out of the cell membrane. They are a problem. They have a problem if there is mercury present. So if you're detoxifying, you are playing with sodium and potassium. Now, there's something called normal. And we have been led to believe that we should be normal. I have had several MDs work for me who tell me the same story. That when it comes to blood chemistries, in talking to your patient, look at the range over here. If everything is in range, tell them they're normal, there's nothing to worry about. I don't know of a disease that I have heard of or seen yet that did not have chemistries in the normal range. So it's normal to be sick. Well, where do these values come from? Usually they come from hospital laboratories where they evaluate the last 100 patients that have been seen. Why are you in a hospital? I was in a hospital last month, and I would not want to consider that normal. I would not wish that on any of you. I certainly don't wish it on me again. But my blood was used in determining what is considered normal this month. My blood chemistry scared me. But what is normal? The average of what you see from people who have had their blood drawn because their doctor wanted to see what's wrong with them. By definition, normal is 95.56% of your studied population. 95.56% of the population are not healthy. So we use the stability range. The stability range is not a mathematical range, but it is a range from observation of thousands of blood chemistries to find out when the highs come down and the lows come up, they hit the same. They hit the same mark, whether you are red, yellow, black, or white. We'll have to exclude babies, small children, but from the time you're about 12 or 14 on, the stability range is the same for everybody. Now, in albumin, there's a fairly wide range. Albumin is different here because albumin is studied in grams percent, where cholesterol, calcium, glucose, these things are studied in milligrams percent. There's 1,000 to 1 difference between a gram and a milligram. And in the literature, I love to quote this, in the scientific literature, you cannot move an albumin more than 1/10 of a point in 6 months. Well, in my recent forays, I was put on a vegetarian diet because that is the healthy diet. I didn't have a whole lot of choice. It was either that or starve to death. My albumin has always run 4.4 to 4.6, sometimes 4.7. On a vegetarian diet, it went to 2.9. I've never seen a 2.9 in anybody who lived. How do you think I felt? Does everybody do well on a high-protein diet? No. Does everybody do well on a vegetarian diet? No. I found out something, though. I found out after a while I could sneak out. There's this place called some kind of foods. What is it, grocery store? Whole Foods. Yeah, you're right. Whole Foods. They have wonderful display, lots of lights on it, and they have these chunks of meat with bone in it. If you take that meat and you saute some onions and a few other things and then put water in it and put that meat in there for a couple of 3 hours, plus some salt, a few other things that are non-biological, the nutrient comes out of the meat, out of the bone marrow, into the broth. So as a scientific experiment, I tried the broth, and I have no financial interest in Whole Foods, by the way. Except that I've donated a whole gob to them. How much can we move the albumin in 6 months? No more than what? 1/10 of a point. But in 5 days, using that broth, I moved my albumin from 2.9 to 3.6. That is, 3 years worth of work, theoretically, in 1 week. So, where is the value in meat? Is it in the meat itself, or is it in the mitochondria? Is it in the cells? Does salt help to bring it out? Do spices help to bring it out? Something in there happens to be true, because There was certainly a big difference in how the patient felt at 3.6 and at 2.9. Mentally in particular, mentally I was at the point where things get foggy. And that's a very unusual, uncomfortable place to be. But I found out what it takes to heal. And it's something that you cannot buy in any of the booths down here. And in the next program, I'll tell you what that was. Now, where do we get albumin? We get it from meat. We get it from the juice, from the stews. Somehow or another, you've got to suck it out there. But vegetable protein does not qualify. Vegetable protein is a different third-dimensional form. It does not do the same thing. Now, the range that I have found over the years is 4.2 to 4.6 grams percent for the stability range, the stability point being 4.6. The source is animal protein if you got teeth and you can chew. You've got to chew and chew and chew, and you do not get any nutrient out of it unless you have sodium chloride, unless you have salt in there. And I don't mean the sodium chloride that's got the aluminum additive so that it rains when it pours. How are you going to absorb it, though? You do not absorb any nutrient without the presence of fats. And I sort of have fun with people when we're talking about coconut oil, when we're talking about olive oil. Are those fats or oils? And almost everybody says they're fats. I says, then why are they called olive oil if it's a fat and not an oil? You need both. You can mix them together. Butter and safflower oil tastes just like butter. And that does give you the combination that is required to absorb the nutrient. But if you do not have fats in the diet, you cannot absorb nutrient. And this is something that there's heavy argument from the vegan, from the vegetarian side. But remember, what is my goal? Chemistries, numbers. Numbers I can see. Numbers I can count. Now, I mentioned cholesterol. Is cholesterol important? Cholesterol has a point at which it has its maximum effect. And these charts show this one is greater than 240 milligrams percent. What happens when you take the interference, when you take out the aluminum crowns, when you take out the amalgam, when you take out the root canals, when you clean out the cavitations? What happens? The high cholesterols come down. Simultaneously, the low cholesterols, well, make up my mind. Which one am I talking about? This is what I'm talking about?
I don't know. Where are we going?
Well, you said that you could lecture with me on these things.
No, it's all you. Go ahead.
Yeah. Okay, where are we? We're on the low ones now, less than 180 milligrams percent. You know, in medicine now, depending on the politics, some places want the cholesterol as low as 100. But there are places that will guarantee you that as you go from 140 to 120, guaranteed you have cancer growing in your body someplace. Low cholesterol is associated with cancer, which may not be fun to play with. But if you get rid of the biological interference, you can take the low cholesterols and see some of them went up as much as 90 points, some 10, 20, 30, 40 points. What is the perfect? perfect is 222. When I studied with Melvin Page in the 1960s, perfect was 222. Today, it is 222 milligrams percent. I don't worry about a 200. I don't worry about a 240. If you get a higher cholesterol, that means your body is trying to detoxify because you may be retoxifying. You may be over-detoxifying the patient. So cholesterol is a good place to look also. Animal protein, I thought butter is where it comes from. If we have somebody with a high cholesterol, 300, 350, 400, someplace up there, I can drop it 100 points in a week by putting the patient on 2 eggs a day and a quarter of a pound of butter a day. According to what you see on television, you would think that would skyrocket it. It does not. We have thousands of tests that show that that's not true. Actually, most of your cholesterol does come from liver. And if you over-detoxify the patient, which means too much, too fast, the liver will not be able to produce the cholesterol that is necessary for proper detoxification. So watch your liver function tests. Watch animal protein intake. Make sure you have fats for absorption. White blood cells are another thing that do your detoxification. The range changes year to year. The range now in some hospitals goes down to 2,300 and up to 12,500. Why? One of the reasons is that many of our composites, over 60% of them, contain high amounts of aluminum. And that aluminum comes out, and we have evidence from the laboratory, from the DNA laboratory, as to what happens as these things change, as they come out. Aluminum is almost, this is the first time I have said this in a group, but aluminum is almost as toxic as mercury. And one of the things that we have shown is that aluminum comes out of the ceramic crowns. We've been removing ceramic crowns for over 20 years, giving a certain amount of credit of our success to the fact that we took out the crowns, and now we can show what happens when the aluminum comes out of the crowns. I think we can all in this group relate to 1 part per million. Can we relate to 1 part per billion? 1 part per trillion? 1 part per quintillion? 1 part per quadrillion? At dosages this low, we are still able to stimulate bacteria to produce toxins that they didn't know how to produce until dentistry put together the marriage between metals and microbes. The white blood cells between 5,000 and 6,000 are protective for you. If they are lower than that, they're fighting and they're not winning the battle. If they're higher than that, they are fighting. Of the white blood cells, the one to watch the most is the lymphocyte. Lymphocytes in absolute count should be around 2,000, 1,800, 2,200, 2,400. But if they get down to 1,200, 1,100, 1,000 or below, we're losing the director of activity of our immune system. Watch it. You may be over-detoxifying. You have A patient who has a problem, make sure you did not create the problem. Vitamin A does have the ability to bring that up. What dosage? Depends on the patient. We used to think that maybe 1, 2, 3 drops would do it. It won't. Now that we're learning more about the bacteria through this marriage between metals and microbes, through all the bacteria from root canals, implants, bone grafts, and these things, which I'll be talking about next, we find that we have a problem that is much more complex than it appeared to be a year ago. But vitamin A helps us out a whole lot. And now we're using a dropper full instead of 1 or 2 or 3 drops. So we're using 10 to 15 drops of a mycelated form, and I don't think that's one company. I think there are many companies who make mycelated forms. The oil form you cannot use high dosages of. The mycelated, you can use higher dosages. And this battle we get into with all the bacteria from the root canals and cavitations gets to be overwhelming. When you get to the point where you've got 20, 30, 40, 50 of these pathogens that you're trying to neutralize at one time, you're going to end up taking 20, 30, 40 antibiotics. But you got to be real careful with antibiotics. That can be more hazard than help. But with the vitamin A, you can use it. How much time do I have left? 10 minutes. How much? 10 minutes. 10 minutes, and you were only halfway through your slides. Okay. All right, globulin is the other protein of significance in the blood. In the blood, you will have a total protein level, and then you will have an albumin. And sometimes they give you the globulin, sometimes they don't. Very simple. They don't run a globulin test. It is too expensive. But what you can do is take your total protein, subtract the albumin, and you have the globulin. You're going to be within 1%. There are some other little proteins in there, but they're insignificant as far as detoxification is concerned. But sometimes white blood cells can't do everything you would like for them to do. So sometimes the white blood cells, I get uncomfortable at 4,500. I notice 49 and 48 because to me it's like an airplane flying over the ocean. 30,000 feet, no big deal. 100 feet over the waves, no big deal. 1 foot below sea level, you got a problem. So this is how I look at white blood cells. As you drop below 5,000, the difference between 7,000, 6,000, 6,000, 5,000, 5,000 and 4,000, there is a whale of a difference. You have lost a lot of immune capacity. So 4,900, 4,800, let's look into this before it gets out of control. But if we do get down to 4,000, what do we find? The globulin is coming to our assistance. Globulin is a backup to the white blood cells. It's supposed to work with albumin, and yes, it does. But also, the thing I note is when that globulin starts hitting 2.8, 3, especially above 3.0 grams percent, you've got a challenge in there, and the white blood cells are having a hard time with it. So thank God for globulin to come in as a backup support team. And globulin comes from the same place that albumin does. You got an animal protein, you're going to have salt in order to digest it. And what do you use to absorb it? What's required? I guess I should turn my hearing aids on. Butter, fats, oils. So with your liver function test, SGOT, SGPT, bilirubin, these are primaries to watch. SGOT, these are ranges that I look for in healthy patients. These are not normal, these are the stability ranges. SGOT, let's get that less than 25. There are commercial products that will bring it down, but of course we can't mention those, so tell your patient, forget it, don't worry about it. SGPT, less than 50. Bilirubin, less than 1.0. And there's one thing about bilirubin. Bilirubin will tend to increase. This has to do with control of red blood cells. It will be on the increase. In fact, I guess all three of these would be on the increase if you're eating too much cheese. Hard cheese. Soft cheeses do not create that much problem, but the hard cheeses will give you elevations of SGOT, SGPT, and bilirubin. And some people who have smoked marijuana will have an increase in bilirubin that you cannot get down. So you try to tell me marijuana is a safe recreational drug, and I will show you cases of cancer where people get very excited about a bilirubin of 1.5, 1.6. We're going to do a liver punch biopsy. What about 2.5, 2.8 that you can get from marijuana? Now, in terminal cancer patients, which I had the opportunity to work with a cancer surgeon for several years, so I saw a lot of chemistries there. And just as an aside, with the high bilirubins in a terminal cancer patient, we could bring that figure down. It wasn't that difficult to bring it down. But I cannot bring it down if it is elevated due to marijuana. Tell me about the safe recreational drug that's worse than cancer. I don't believe that. But elevations indicate too much detoxification. There are methods of enhancement where you can make these things work faster, more efficiently. I guess the one I can talk about that's not financial to anybody except the companies that manufacture it is intravenous vitamin C, given slowly. Oh, does the liver like that? It does a very good job. Creatinine is your kidney function. And this is one we have to watch for with glutathione. I had mentioned that earlier, that glutathione is being touted as being sold a whole lot now. And we have done studies on patients who have no amalgams, no root canals, no cavitations. You know, they are about as clean a dental patient as you can find. So when you add something to them, if there's a change in blood chemistry, that's the only thing that can do it. It cannot be a reaction to a root canal because there aren't any there. And what we found is a hodgepodge of a mess that happens with glutathione with the dosages that are generally administered. And so in working with this with some big people who are, you know, like 6'12", great big people, and with little people, we found that 1 milligram per pound of body weight is a good target. You don't have to be that specific with it, but a lot of people with IVs are giving 1,000 milligrams, 2,500 milligrams, 10,000 milligrams, and it just does too big a job of REtoxification. So for most people, when looking at glutathione, we would think of 100 milligrams, 150, 200. That's really close enough. But glutathione can mess with kidney function. Kidney function is where the glucuronidation takes place, where you take your toxins and convert them into something that's water soluble so you can get rid of it. So watch Creatinine, watch your kidney function. Liver function you can move around fairly easily. Kidney function you cannot. But kidney function can be changed by the use of IV vitamin C, but we're talking about 50 grams a day for 1, 2, 3 weeks. And then you can show that. But in dentistry in particular, you need to be concerned and aware of this, because dentists get a snoot full of mercury every time you cut out an amalgam. And the mercury goes to the kidney, and I would say it would not be unreasonable to say anybody who had been in dental practice more than 3 or 4 years had glomerular nephritis of the kidney, an autoimmune disease in the kidney. You cannot avoid it. You know, how long can you swim without getting wet? How long can you cut out amalgam? There's one I've run into recently. I have good friends who are identical twins. Having known them for 40 years, I can't tell them apart. So they're really identical. One of them for 12 years has been in a mental institution. The other one is just as sharp as he ever was. One of them cut out amalgams, the other did with Crown and Bridge. I'll show you in the next program where the differences were between the two. Do you have to guess? I think that one is a no-brainer. Sodium, potassium, and chloride are the electrolytes that are important. Nerve impulse transmission is the exchange of sodium and potassium. And when you get to the synapse, things are a real mess. There's just all kinds of stuff going on there. And if you detoxify too fast, you will throw mercury and other toxins into that synapse, and there goes your nerve impulse transmission. Here comes your neurological disease. It is also fairly important in cell membrane selective permeability. We're getting things in and out of the cell. Sodium and potassium pump is what it is called, where you are getting things in and out. Low sodium diets do not enhance your efficiency here. So these are the values to look for, the stability points, relatively easy to establish. 142 milliequivalents for sodium, 4.5 for potassium, 107 for chloride. It took several years to come up with these values, and then I was taking a course a few years ago in forensic toxicology, and we had to study the brain. And at the synapse, sodium, potassium, and chloride are very important. And in a healthy body, the sodium is 142 milliequivalents, potassium 4.5, chloride 108. So I was close. But if I had just looked at that one page in a textbook, it would have taken me 3 years less hard work to find there is a stability point for sodium, potassium. How much salt is that per day? The answer is that depends. Because if you take a disease like Lou Gehrig's disease, we have one patient who required 7 tablespoons a day to keep in balance so that she wouldn't have too much phlegm in her throat, so that she was strangling herself. 7 tablespoons, some people a half a teaspoon, some people a teaspoon. You cannot guess, except if they have a neurological problem, you're going to need more sodium. If you have an infection, you're going to need more sodium. If you have a sore throat and you gargle with salt water, how many minutes is it before things feel better? It's that long. And it feels better because sodium kills. We what?
You have more slides, but you don't have more time.
Well, I'm out of time, but I'm not out of information.
Yes.
Yeah, well, that's happened before. All right, so we're out of time. We will stop there. Thank you very much. We'll get into bone grafts soon.